It also, I think, a newer interest in the last 10 years or so is neurogenesis, and it may enhance neurogenesis, and that might explain why with treating patients with antidepressants, for example, you may need to keep them on not just for a few weeks, but for 6 months to a year. The evidence of the neurogenesis comes from data about sexual trauma, physical trauma, chronic pain conditions are associated with reduced neuronal density in brain's pain control areas. Here's a bunch of studies going back about 15 years, starting with major depression and bipolar disorder, and then also work by Doug Bremner looking at sexual and physical abuse, looking at reduction in about 50% of cortical volume of the hippocampus head. And then with chronic somatic pain, irritable bowel syndrome, even painful chronic pancreatitis is associated with reduction in density in areas of the brain. Here's one study looking at chronic hip pain, which is a chronic pain condition. And in this study, they did voxel-based morphometry to look at the density. And what you're seeing here in the anterior cingulate cortex, the yellow represents less density than control groups. So presumptively, the chronic pain may be associated in some way with lower density, which may be amplifying the pain effect. Now they had their surgery. They look at them 4 months later, so they've not had pain. And now they look at the cingulate cortical area and compare it to pre-treatment when they had chronic pain. And the orange represents an increase in density. So again, suggesting that chronic pain can do this, and maybe the neuromodulators can play a role in preventing this. The theory is based on Tariq Pereira's work from Columbia, again, looking in depression, that the neurogenesis of the dentate ganglion may be suppressed in stressful situations, shown here, but with proper treatment, you may restore neurogenesis.